Hey everybody, so we're going to get started with your spinal pass session. So I'm going to work through the book kind of page by page sequentially. I will point out important topics. I'll mention common test questions. So I really hope this is helpful. If you have any questions along the way, please feel free to reach out. I've made these kind of summary slideshows, so feel free to use them. And I also have some practice questions, and I will be making videos on some more of the diagrams to hopefully help you out. But again, please feel free to reach out. If there's anything in particular that you would like me to do that I haven't done, I will put that on my to-do list. All right, so we will start with osteology. That's going to be page 1 to 5. It's a lot of review. I'll kind of explain some of the common questions and the things to really pay attention to on this one. So first of all, we've got these 3 basic concepts. So number 1, the body has 4 basic tissue types. This is a common test question. It would be a fill-in-the-blank style test question. So know that you've got your connective, muscular, epithelial, and neural tissues. Be able to list those out. So if you're a mnemonic person, we have the CONMEN mnemonic. So CON for connective, M for muscular, E for epithelial, and N for neural. Know the 3 different bone cell types. So you've got your osteoblasts, B goes with building, bone building cells. You've got your osteocytes, bone nurturing, your osteoclasts, which are your bone remodeling. You've also got to understand the bone matrix, so know that there are lots of glycosaminoglycans as well as type 1 collagen. That should make sense to you because if you recall from Phys 1, type 1 collagen is really important in strength, and obviously bony tissue is known for its great strength, so it makes sense that it would be in high quantities there. Okay, so the features of living bone that Mr. Mortar likes to highlight are going to be these remodel, age, and heal. So we've got RAH. If he asks you a question regarding the characteristics of living bone, your answer is going to be the remodel or respond, age, and heal. So he could also ask another question. There's some example questions down below. Hopefully you can see this pointer, but if not, I'll really messily draw on this. So what are the 3 ways living bone responds to stress? So that's going to be a different question. So remember, it's remodel or respond, age, and heal are the 3 features of living bone. But then if he asks how they respond to stress, that's going to be your anxiety, tension, and pressure. And so I put them in this order. Hopefully you can remember, is it ATP? So if he asks what the 3 functions of living bones are, that's where we got our remodel, age, and heal. So do know that the repair/grow is going to be used as a distractor, but that is not correct. Don't choose that one. Remodel, age, heal. This could be a multiple choice question later on. It'll typically be a fill in the blank on your first exam, if we ever get there. So it's possible that repair could imply a pathology, but growth and repairing is kind of redundant with the word heal, so you can't add that to your R. So there you go. If you're a Lady Gaga person or another memory trick person, RAH, rah-rah, remodel, age, heal. And then response to stress with anxiety, tension, and pressure. So that's your ATP. Okay, moving on to the different types of ossification. So you need to remember that intramembranous ossification is what happens earlier on in development, and that is where bone is derived directly from mesenchyme. So intramembranous goes with mesenchyme. So know what bones this is typical of, and know that it happens earlier than our endochondral ossification. Typically earlier, there's some overlap. So know that that's going to be the flat bones of the skull, your mandible, as well as your clavicle. The clavicle is a big one. This one always shows up as a test question because it is unique. So endochondral, chondral, oh my gosh, that's messy, indicates cartilage. So endochondral ossification is derived from cartilage. So know that that's going to be the remainder of the skull, so not the flat bones, and the remainder of the skeleton. So typical question is which bone undergoes both intramembranous and endochondral ossification, and that's going to be the clavicle. There are other bones, so this got cut off a little bit here, sorry. So the temporal, occipital, sphenoid, mandible, and clavicle all undergo both, but uniquely, the clavicle is the only bone of the appendicular skeleton that goes through both intramembranous and endochondral ossification. So definitely know how unique that clavicle is, and remember that that intramembranous ossification is going to be typical of the flat bones of the skull as well as part of the mandible. All right, so on page 3, we're going to be talking about the bone variation. So on this page, it's really important to know the AKAs because he will switch them up on you. So definitely be comfortable with these ones. So know that sexual dimorphism is technically, for the purposes of Mr. Mortar's class, an AKA of gender variation. Ontogenetic variation is going to be related to growth and age variation, so definitely remember how to spell this. Ontogenetic. That's typically misspelled. Mr. Mortar does count off for spelling. So ontogenetic growth and age variation. The third one is the geographic or population-based variation, aka ethnic background. And then we've got our idiosyncratic. So this is another one that people often misspell, idiosyncratic variation, which is your individual variation from person to person. He'll often use idiopathic variation as a distractor, and that is incorrect. So know these 4. I would be able to write them out in a fill-in-the-blank style question, and also be able to pick them out of a multiple choice style question with your appropriate distractors. So definitely pay attention to ontogenetic, idiosyncratic. All right, moving on to the bone classification. That's going to be on page 4. So there's a lot of words here. I'm also going to send out a PDF for you so you can read everything, but I'll just point out some of the biggest hitters here. So moving right down here to flat bones. So remember how we talked about the fact that flat bones of the skull are really classic examples of bones that undergo that intramembranous ossification, which means ossifying directly from mesenchyme. So know that the parietal bone is the best example of that in the skull. And then they have a thin layer of spongy bone between compact bone. So that spongy bone, if you look over at that image here, I'm just underlining it in blue, know that that's called diplo. So diplo is unique to the spongy bone in between flat bones. So another great example of a flat bone is the sternum. So hopefully that helps to give you an idea. A lot of people still get mixed up on their bone classifications, so I would definitely try to familiarize yourself with this just so it becomes second nature. Also, go to page 271 to 273 and look at those bony features. That's another important page. Okay, know that paranasal bones and pneumatic bones are not AKAs for one another. So a lot of times through the book, when there is a slash between words, it means AKA. Sometimes it does not. So this is not one of those cases. That's why I have them separated in 2. So paranasal means exactly what it sounds like. Para, across from, like around the nasal cavity. So anything that's around the nose is going to be a paranasal bone. So we're talking about things that form our sinuses. Our pneumatic bones, on the other hand, are going to be full of air cells. So they're very light and airy cells, bones. So So a lot of these paranasal bones are pneumatic bones, but pneumatic bones aren't always paranasal bones. So I would just kind of glimpse over this, know that your frontal ethmoid, maxilla, and sphenoid, those are all paranasal bones. They help to form those sinuses, and if you think of where they are around your face, that's going to make a little bit more sense to you. Your temporal bone, on the other hand, is a pneumatic bone. It does have air spaces, but it is not a paranasal bone. Think of where your temporal bone sits versus these paranasal bones. And a quick question that is often used as a distractor, are the ribs pneumatic bones? We think of the ribs, we think of the chest cavity, we think of the lungs and air. So a lot of people get mixed up in the fast pace of a mortar exam, and they will mistakenly list ribs as pneumatic bones. They are not. They are not pneumatic bones. They are strong, they are thick, they are there to help protect your lungs. They're not designed to be light and airy. All right, quickly back to those flat bones. Remember the diplo. So someone always described the diplo as or the flat bone as a diplo sandwich. So the diplo would be the spongy bone in the middle, and the pieces of bread would be the compact bone on either side. Okay, additional classifications. So this is on the bottom of page 4. So know that we've got accessory bone and heterotopic bone, and know what those two mean and how to spell them. So know that accessory bone comes from existing bone. It is an extension of existing bone due to stresses put on it. So you can see in this X-ray here, we've got some bony spurs, osteophytes. Those are going to be all examples of accessory bone. We've also got the para-articular process. So this is going to come back time and time and time again. So we'll talk about it multiple times. I'll tell you where it's typically found, which will be helpful on your lab exams. But definitely know how to spell para-articular process. Know that it is a form of accessory bone, and we'll talk about it more later. And then we've got this heterotopic bone, not heterotropic. Definitely know how to spell this without an R, heterotopic. Know that this is bone formation within non-bone related tissue. So if you remember from CNS, the brain sand, that can be ossification within the pineal gland. You can have ossification within the heart. And here we can see some ossification in the muscle. So that could be due to trauma, as well as in ligaments. Okay, before we move on to the skeleton, just take a look at page 5. Also go through page 271 to 273. Take a look at those bone surface features, and I will do another video to help you with those. But definitely try to get yourself familiar with them, because there will be lots of questions throughout your time in spinal. All right, moving on to the skeleton. So just a quick review, pages 6 and 7. I'll tell you the important parts here. So know that there are 206 individual bones in the skeleton. That's an important number. I would definitely know that. Know that there are 80 in the axial skeleton and 126 in the appendicular. Remember, the axial skeleton is kind of central, so it's the colored part in this diagram. So that's going to be your head, your chest cavity and thorax, and your vertebral column and sacrum. It does not include your girdles. So you've got your shoulder girdle and your pelvic girdle, which attach your appendages, your arms and your legs. So those are all going to be part of that appendicular skeleton. So those numbers, 206, 126, 80 are all important to know. Learn a couple of them and you'll be able to work out the rest. All right, so you guys will go into a deep dive of the skull later on in your course. So right now we're just going to hit some of the high notes. So know that there are 28 bones in the skull, and then the rest of it will be kind of terminology. So your cranium is your skull minus the mandible. So he might have a multiple choice question that asks you what the bones of the cranium are. So typically your outlier is going to be the mandible. So just know that the cranium does not include the mandible. If you are awesome at memorizing all the things, then go ahead and memorize that parietal, ethmoid, temporal, sphenoid, occipital, and frontal bones make up the cranium. And then the calvaria, so that it means the skull cap, that is an AKA. And then your neurocranium, so know that there are 8 bones that make up the neurocranium, and neuro is indicating brain matter, so it would make sense that the neurocranium are the bones that surround the brain. So know that there are 2 paired and 4 unpaired. 2 paired, your temporal and your parietal, there's 2 of each, 1 on each side. And then your 4 unpaired, so your ethmoid, your sphenoid, your occipital, and your frontal bones. So I would look at an image while you're studying these, just to help clarify some things. And then your splanchnocrinium or facial skeleton. So again, these numbers, I would be familiar with them. Know that you've got your 6 paired and 2 unpaired in this one. So it's different, your splanchnocrinium or your facial skeleton. I'm not sure who you had as your embryology PASS tutor, but our PASS tutor said whenever you said splanchnocrinium, you should put your hand straight up to your face, so you knew that you were talking about your facial skeleton. So 6 paired, nasal, lacrimal, palatine, maxilla, zygomatic, inferior, nasal concha, those are your 6 paired, and your 2 unpaired, which are your vomer and your mandible. I would memorize those. I would know that there are 14 of them. And just try to be familiar with where the bones sit so that you can think it through. There's a lot of information here, and typically you can pick out an outlier on the multiple choice questions. Just be familiar with what the question is asking. All right, moving on to the auditory ossicles. So those are part of the skull, believe it or not. And this one is important to know. So know that there are 6 auditory ossicles, or 3 pairs. So when he's asking questions, he might ask you how many bones or how many pairs of bones. Those are 2 different questions. If he asks you how many auditory ossicles there are 6. If he asks you how many auditory ossicles are on one side, or how many, then your answer would be 3. So you've got 3 pair of auditory ossicles. So be able to write those out in order. He will typically ask a fill-in-the-blank style question. It will either ask you to name the auditory ossicles from lateral to medial or from medial to lateral. So MIS, malleus, incus, and stapes, that's going to be lateral to medial. So definitely know that. Okay, so on page 7, we talk about the vertebral column, aka the spinal column. So there's a lot of terminology that can get a little confusing here. So definitely read your questions carefully. So there are 26, so I'm skipping down to the middle here, bones in the vertebral or the spinal column, because it includes the spine plus the sacrum plus the coccyx. So 26 in the vertebral or spinal column. If, however, he's asking for the number of bones in the spine is also known as the presacral region. So the sacrum and coccyx is not included in the spine. So read these carefully. I'm sure most of you know there's 7 cervicals, 12 thoracics, 5 lumbars typically in the spine. And then we have 1 fused sacrum. As an adult, that will be 1 segment. As a child, that will be multiple segments. And then 1 coccyx, which again, as a child, will be more segments. But be familiar with the difference between the spine or the presacral region and the vertebral or spinal column. As far as the sternum goes, when you learn about the sternum, a lot of people get confused with this because there are 3 regions of the sternum, but it is 1 single bone. So the sternum is 1 bone. So definitely be familiar with that now. And we'll talk about the features of the sternum later. Ribs, again, remember how I talked about the auditory ossicles and how he can phrase questions. He does the same thing with ribs. So if he's asking you for the total number of ribs, 24 ribs. If he's asking you for the number of rib pairs, that's 12. So those are two different things. A lot of people will write 12 for the total number of ribs, and he will mark that as completely incorrect. Okay, so later when we get into this, I just want to point this out now. This image has something that is listed wrong. So when we talked about the features of the bony surfaces under linear, so this is page 5, we've got lines, ridges, and crests. So lines are going to be less prominent, ridges are going to be more prominent, and crests are going to be the most prominent. So that's the way that works. So when you look at this image, let's see, where it said transverse ridges, that was incorrect. There's transverse lines on the sternum, and we'll go through that time and time again. So moving on. Okay, sometimes there's questions about the adolescent spinal column. So remember how I said the sacrum and the coccyx are single bony features in the adults. They are multiple bony features in children. So we're going to have different numbers associated with our vertebral or spinal column, because those are the only ones that include the sacrum or the coccyx. The bones of the spine will be the same number in adolescence. But because the sacrum is made of 5 different segments that wind up fusing in adulthood, and the coccyx is made of 4 different segments that wind up fusing in adulthood, the adolescent spinal column will have 33 segments. And then the sternum, just a little bit, we'll talk about it more a little later, but we've got our sword handle, which is our manubrium, our corpus or body, which is the sword blade, and the xiphoid, which is the sword tip. So it's named after a sword. Okay, we're going to move into some of the meat of it. We're going to talk about the vertebral, the spinal column. That starts on page 8. It goes further, but we're going to stop at page 21 for this review, and we're going to continue in the next lecture. Okay, so quickly before we go into the measurements that are on page 9, I want to just point out a couple things on page 8. So under those general characteristics, he's got a couple of interesting terms that are used and occasionally show up on tests, so I just want to point them out. Down those bottom 3 points under general characteristics before that box, so lumbar means loin, the sacrum has a connotation with the divine, and it's called the holy bone, and then the coccyx is sometimes referred to as the cuckoo's bill. So those are 3 things that could occasionally show up on an exam, so I would just read them once. They're kind of silly, and you'll remember them. All right, moving on to the measurements. So these numbers are actually important and are very common test questions. So you can either memorize either the centimeters or the inches and know that 1 inch equals 2.45 centimeters. Or what I did, honestly, is I should fix that. That's supposed to be inches. Down there, I just memorized kind of the bookends, so know that the cervical's 5, the sacrum's 5, or 12 and 12, and then your thoracic is going to be longer, and your lumbar is going to be longer than the cervical and sacrum, but shorter than the thoracic. So being able to put them in some kind of order like that, if you're good at memorizing things, I would definitely go for it. They're important measurements to understand. Also knowing that the male spinal column is typically longer than the female spinal column. Sorry if you can hear my dog barking. So an interesting little feature, the spinal column is pretty consistent in its length. Whether you are 6'6" or 5'6" and a male, you're typically going to have approximately the same length spinal column. So that height will be made up in other areas, like the femur. So it's relatively consistent. Also know that the cervical region is going to be the most stable region in the animal kingdom. So when we're talking about that, we're talking about the typical number of vertebrae. So in most animals, we've got 7 cervical vertebrae, including in humans. That's very consistent. And later we'll talk about some variations in that Mr. Mortar likes to ask questions about. So because, I don't know why this is cut off down here, I apologize. So a typical question would be the variations in the number of vertebrae. Where would you least likely see variations in the number of vertebrae? So that's obviously going to be your cervicals. Real important. So definitely know that. All right, so your functions of the vertebral column. These are super important. I will, again, save you from just having me read them at you and just point out the important parts so you can review this on your own time. So know that the vertebral column is involved in weight-bearing transfer. So this point right here, know that transfer. So from the spinal column, the weight is being transferred onto the pelvis at that S1 to S3 auricular surface. So those are important concepts. Think of the way gravity works when you're standing up, how that weight is going to be dispersed into your lower extremities. So that's all going to happen at that S1 to S3 auricular surface. Moving on, you can read all of that, but this one down here, this is a very common fill-in-the-blank question. So know that your eyes and your vestibular apparatus are going to be heavily involved in your vertebral column. So that is where this point down here, your spine, your vertebral column, or your spinal column, is designed to keep your eyes and ears in line with the horizon. So your eyes and your vestibular apparatus. So your vestibular apparatus is involved with equilibrium, not balance. And know that it requires a horizontal axis for optimum function. So that's why when you see people who have terrible scoliosis or they had tuberculosis, which became Pott's disease, and they have a lot of changes in the vertebral column, you'll notice that their spine shifts. You wind up having compensatory curves in order to keep your eyes and ears in line with the horizon. So they typically don't have a head that's tilted to the left because that would impact their vision and equilibrium. So that is super, super important. And a common question for this is which cranial nerves would be involved in that eye and vestibular apparatus regulation. So hopefully you remember that that's going to be the optic nerve, so cranial nerve 2, and the vestibulocochlear nerve, so cranial nerve 8. Definitely make note that it is the vestibular part of that vestibulocochlear nerve. So when this is a fill-in-the-blank question for you, make sure to highlight that it is the vestibular part of the vestibulocochlear nerve, because we're not talking about hearing, we're just talking about the vestibular apparatus. All right, embryology. I made you guys a video, so I'm gonna move over this pretty quickly. So remember that paraxial mesoderm, then your somites, which become your sclerotome, myotome, and dermatome. Know what they become. And then when you have your membranous vertebral column, so the steps of this are going to be your formation of your perichordal blastema. Definitely know these guys. Remember I said on the embryology video that these are very common fill-in-the-blank questions. What is the future intervertebral disc? And that's going to be your intrasclerotomal fissure of von Ebner, or that first indication of the intervertebral disc. And then your perichordal disc is going to be the location of the future annulus fibrosus. And then remember how I talked about how important that migration was. So remember the dense stuff wants to go down and the loose stuff wants to go up. So your dense, wow, I have that written wrong. So I am sorry. I'll fix that before I send you the PDF, but I can't re-record this from the beginning. So your loose cranial sclerotomite migrates cranially. Your dense caudal sclerotomite migrates caudally. So I'll fix that. That is wrong. So sorry. Okay, but definitely watch that embryology video because it is all written out correctly and explained there. and I will fix that before I send it to you. Once that vertebral blastema is formed, so vertebral blastema here after that migration, know that the cell density is more uniform, and then we've got a segmental artery, which is right in the middle of that vertebral blastema. All right, so moving on to the cartilaginous vertebral column, I would know the centers of chondrification. So know that these are paired centers, so there's 2 of each of them, and that's each of those little dots is a center of chondrification. There's 2 in the centrum, so in that future vertebral body. There's 2 in the neural arch and 2 in the transverse processes. So a common test question would have those listed as well as spinous process. So know that there is not a center for chondrification in the spinous process. That's our little question there. Moving on, so our skeletal or osseous vertebral column, that I would know that, well, obviously this happens later, so that's 7th embryonic week, but it continues to ossify until at least 25 years old. And then we want to know the difference between primary centers and secondary centers. So primary centers are going to arise before birth, and secondary centers of ossification are going to arise after birth. So I'll explain that a little bit more on the next slide. Know the order that it happens in. So the ossification begins at that CT junction, so the cervical thoracic junction, and it's going to proceed cranially, so towards the upper cervicals. And then after that, it goes down through the thoracics and then into the lumbar region of the spine. So it starts in the CT junction, then goes up, and then it comes back down all the way. And it's going to conclude down in that lumbar region. I think I skipped over it, but on page 12, the cartilaginous vertebral column, know that that one starts in the cervical region and goes caudally, so top to bottom. This one kind of starts in the middle and goes up and then down. Know this ratio. This is important, and I'll talk about the difference between primary and secondary again more on the next slide, but there's 3 primary to 5 secondary centers of ossification for the skeletal or osseous vertebral column. And then down here, this is a very common test question, a fill-in-the-blank question. So he will often ask what the 3 stages of vertebral column development are, and they are in order: the membranous vertebral column, the cartilaginous vertebral column, and the skeletal or osseous vertebral column. So those are the 3 successive vertebral columns. It is a weird question, but that's a typical fill-in-the-blank. All right, so I said I'd talk more about those primary and secondary centers of ossification. So remember, primary before birth, secondary after birth. Remember that 3 primary to 5 secondary ratio. Definitely know that. And then know what happens where, and particularly what is missing. So when we look on the diagrams from the book down here, we've got a single centrum center, and then we've got our paired neural arch centers, so those guys. Those are going to be our primary centers of ossification. Then when we talk about our secondary, we've got 5. So know that we have paired top and bottom epiphyseal plate regions. So top up here, dink, and bottom. I know there's a lot of dots, but those count as individual secondary centers. So 2 there. You've got 1 on each transverse process and 1 on the tip of the spinous. So that's the first time we've seen a center of ossification on the spinous process. Again, so I would be able to recognize the difference between primary and secondary, and where you're seeing different centers of ossification or chondrification from before. All right, so underneath I have these little bullet points that talk about the different synchondroses that are formed by these ossification centers. So you know that when ossification begins, it doesn't just happen just like that. So it's going to start to develop. So what occurs between the bony formation is going to be called a synchondrosis. So it's still cartilage, in that area. So neurocentral synchondrosis is going to be the synchondrosis between the neural arch. The neural arch is what surrounds the spinal cord. And then central is going to be the body. So neurocentral synchondrosis is between the body and the neural arch. So that's going to be here. So it would make sense that that would form between the centrum center and the neural arch center. And then we also have a neural arch synchondrosis. So we've got only one of those because that's going to form between the two different neural arch centers. So I would be able to understand the words so that you can appropriately answer a multiple choice question that would ask something like that. So the same thing goes for our secondary centers of ossification. So know where those synchondroses are going to be, and that will help you understand where there are two or one. It just works if you kind of think of the geographical location. So the epiphyseal ring synchondrosis, those are going to be kind of around inside that plate center there. So remember, this is going to be important to note. Epiphyseal plate regions, those are secondary centers of ossification. Epiphyseal rings, those are going to be your synchondrosis. So definitely be able to distinguish the difference between what should be found on the epiphyseal plate versus what should be found on the epiphyseal ring. Then when we're talking about the tip of the transverse process synchondrosis, we've got two TVPs, so it makes sense that there are two tip of TVP synchondrosis, and then we've got our spinous process synchondrosis. So that's going to happen there where that secondary center of ossification is. So it's what's left over. Okay, so page 15, there's that diagram for the general organization. All right, so we talked about the vertebral bodies. Now we're going to shift backwards a little bit, or more dorsally. And so right off of the vertebral bodies are our pedicles. So what's important about them is their orientation and where they sit on the vertebral body. So in the cervicals, they are directed posterolaterally. So backwards and outwards laterally. So again, hopefully you can look at your bag of bones and that will make sense. They're also quite midline on the vertebral body. So those are two facts that are important to know. In the thoracics and lumbars, these can be lumped together because they are more uniform. So their pedicles are directed more straight posterior, and they're going to be on the upper 1/3 to 1/2 of that posterolateral margin of the vertebral body. So remember how I said the vertebral arch is what surrounds the spinal cord? So we've got our vertebral body here, and then the rest of this that forms that arch is going to be the vertebral arch. So the pedicle is going to be the most anterior part of that vertebral arch and connects it to the body. And then we will talk in depth about intervertebral foramen. So the pedicles form, here's our little intervertebral foramen. We're going to have a spinal nerve root coming out of that foramen. This is important to start to understand now. So if we called this L1 and this L2, this would be L1 nerve root. So you might be asked what forms the superior boundary of the L1 nerve root intervertebral foramen. So the superior boundary up here is going to be the the undersurface of the pedicle of L1, or the undersurface of the pedicle above, whereas the inferior boundary is going to be made by the superior surface of the pedicle of L2, or the superior surface of the pedicle below. Again, I'll make some videos on those IVFs, which will hopefully make some more sense. All right, moving backwards. So we talked about the pedicles, and then the next part of our vertebral arch, which would be kind of posterior to the TVP, transverse process, would be our lamina. So know that those are directed posteriorly and medially because they join in the posterior part of that neural arch, and they complete the vertebral arch where they join. So important terms to understand about lamina are shingling, and know that that is where lamina overlap. So you would see this on an AP x-ray, but know that shingling is indicating overlap of the lamina. So think of shingles on the roof of a house. That's going to be your lamina. And then imbrication, so know that that is not talking about lamina, that is talking about the spinous processes. So remember in palpation class, you talk about the imbricated area, so that's T5 to T9. That's where the spinuses are the longest, and they are going down and over one another. So they are overlapped, the spinous processes. So the difference between shingling and imbrication is important to know. Okay, so we've talked about this once before, and I would just like to reiterate the para-articular process. So remember when we were talking about accessory bone formation, and we talked about the para-articular process, and I told you that that would be an important word to know how to spell. So know that that is accessory bone formation, and it's ossification of the ligamentum flavum. So you're going to often see this at T10, and it looks like a little spike. And I already answered the question. So what kind of bone would a para-articular process be? Oops, sorry. I jumped ahead, but that was going to be that accessory bone. All right, the lam-ped junction, lamina-pedicle junction. So that's going to form these very important features that go by different names between the cervicals. And again, the thoracics and lumbars can be lumped together, which is kind of nice. So in the cervicals, the lamina-pedicle junction forms the articular pillar. And in the thoracics and lumbars, it has a much fancier name called the pars interarticularis. So definitely know how to spell both of those, know what applies to what. If Mr. Mortar's talking about a pars interarticularis, you know he cannot possibly be talking about the cervical region because those don't exist there. And conversely, if he's talking about an articular pillar, you know he must be talking about the cervicals. All right, another junction, so spinal laminar junction. Remember how the lamina fuse to complete that neural arch? Then the spinous is going to come off of that. Spinous attaches to that lamina where the lamina fuse. So note that this junction is actually only visible on x-ray. So you won't be able to see it when you're looking at physical bones. And down at the bottom here, I just have a quick question for you. So what are the 3 types of apophyses that radiate from the vertebral arch? So know that an apophysis is essentially just a protrusion from the bone. So what protrudes from the neural arch? You know, you've got 2 transverse processes as well as a spinous process and the articular processes. So those are the 3 different types of apophyses that radiate from that vertebral arch. All right, now talking about them. So we've got our transverse process, or TVP. So the orientation of these is important to know. Know that the cervicals point anterolaterally. So put your arms out in front of you and kind of a little bit away. So kind of your body is forming the apex of a triangle if you're trying to make that shape. So that's going to be the orientation of the cervical transverse processes. They also point a little bit downward. So, and the reason that those point anteriorly is because of, remember, soft tissue remodels hard tissue. So the brachial plexus is going to be tensioning and pulling those TVPs forward throughout their development. So anterolaterally about 60 degrees. So you can see that here on the image on the right. The thoracics, those ones go posterolaterally, which is why it's a little bit easier to get that TVP contact or feel them when you're going through palpation classes. Those are going to be posterolaterally, again, because we have the ribs that attach in the thoracics, and those are going to be pushing those TVPs a little bit backwards. So again, soft tissue remodel's hard tissue, so the lungs are constantly inflating and stressing the ribs, pushing them out, which is going to in turn push the transverse processes posterolaterally in the thoracics. Then in the lumbars, they are straight lateral, so know those different orientations. So I would review this a little bit and just be aware of that orientation, and then definitely know what is going to be found on the different transverse processes. So remember how each transverse is going to end in a transverse tubercle, and then know that there will be a costal element that is present everywhere but the thoracics. So the costal element is going to be what gives rise to the ribs. So it remains a remnant on the cervicals and the lumbars, but vertebrae that have ribs don't have a costal element. So the articular processes, we kind of talked about this a little bit. So articular means that's going to be your joint surface that's between the two different vertebrae where they articulate. And know that that's going to form a zygapophyseal joint, or zygapophysis. So this is important to understand and definitely be able to spell this word, because you're going to have to spell it a lot. So the articulations within the vertebral column are going to be those zygapophyseal joints. So you can see on the diagram on the right, again, I'll go through all of this in more detail when I do an IVF drawing, but we've got, you have to draw a line straight down through that joint capsule space, and then if you're coming from this direction, from the vertebral body, everything in front of the line is going to be considered pre-zygapophysis, and everything on the other side of the line is going to be considered post-zygapophysis. So when we're talking about these articular processes, you can see that in front of the line is going to be the superior articular process of the vertebral body below. And on the post-zygapophysis, that's going to be the inferior articular process or facet of the vertebral body above. So definitely try to get yourself familiar with that. All right, moving on to spinous processes. So the important thing to know, again, just remember that imbrication has to do with spinous processes, and then the angulation of the spinous processes change as you move down the spine. Okay, I'll do a quick IVF review, and then I will have that video for you guys. So as far as the boundaries for the IVF, so hopefully this diagram on the right will be a little bit helpful for you because it's color-coded, but the video should be the most helpful. So know that on the anterior part of the IVF, so this is our IVF right here, a little circle, scribble. On the anterior side, we've got our vertebral body above, we've got our intervertebral disc, we've got our vertebral body below, and then this ligament which goes along the back side of the vertebral bodies. So the posterior longitudinal ligament forms the anterior boundary of the IVF. So lots of posteriors and anteriors, and they don't agree with one another. So definitely I would do some work to make sure you're familiar with this. All right, and then the posterior part of the IVF. So we'll go from front to back, because remember your vertebral body is going to be in front, your spinous process is in the back, so this is posterior. So starting in yellow, we've got our ligamentum flavum, and then we've got our capsular ligament, and then we've got our pre-zygapophysis. Remember that's going to be the superior articular facet of the vertebral body below, and the post-zygapophysis, which is the inferior articular facet of the vertebral body above. So those are going to be forming that posterior boundary of the IVF. And then superior, again, these orientations are important to understand. So the superior part of the IVF is going to be the inferior vertebral arch of the vertebrae above, and then the inferior boundary is the superior vertebral arch of the vertebral body below. So here's a common fill in the blank question. Name all the anterior boundaries of the C8 nerve. And name all the, so if he says name all the anterior boundaries, he's talking ligaments and bones. So it's going to be everything on this list. However, if he asks you to name all the membranous boundaries of the C3 nerve, then you're just looking at ligaments. So definitely read your questions, and we'll go through those on the diagram video. All right, so this will be the last slide for this this lecture, and then we'll go into the vessels. I'll do a special video with that drawing. So again, shapes of the vertebral foramen. We went through the vertebral bodies, so now we want to know what the typical shapes are for the vertebral foramen. So for the cervicals, remember we had a rectangular vertebral body. We're going to have a triangular vertebral foramen. For the thoracics, we had a triangular vertebral body. Now we have an oval-shaped vertebral foramen. Lumbars, remember we had that kidney bean or reniform-shaped vertebral body. Now we have a triangular vertebral foramen. So the way that I think about it is they all have something that's triangle-shaped. So for the thoracics, they have a triangle-shaped vertebral body, so they don't have a triangle-shaped vertebral foramen. And again, just look at your bones, and this will all make a lot of sense. So that triangle holds true down through the sacrum, and then just know that your spinal cord is going to terminate at L1, so that's important. We're going to talk about that a lot in the future, so now's a good time to start to recognize where the spinal cord terminates, and we'll carry on with the arteries and other blood vessels next time. Hope this was helpful.